Carline here. So let's learn about LSIL, which comes with our pap smear results that we see pretty frequently. I'm your local OBGYN. I love all things, including your pap smears. So let's talk about low-grade lesions on paps. Pap smears come back and they kind of give you like a stepwise report, and it's either like normal, atypical cells, low-grade cells, high-grade cells, and very rarely will you see something that actually says cancer, but low-grade is pretty darn common. The cells do have an appearance that is abnormal, and a lot of the times the pap smear won't even then look for HPV, which is the cause of these abnormalities, because it's assuming that HPV is the culprit and cause of the pap smear. So if you get a low-grade pap, there's a few different things that can happen. If it is your first time and you are 25 or older, the recommendation is going to be that you get a colposcopy, which is when we take that large microscope and we look at your cervix and we zoom in really close, and that way we can see the abnormal look of the cell potentially. The reason that you get a colposcopy is because you want to make sure that the pap smear is not underrepresenting the abnormality. And by looking at a colposcopy, you may end up taking a biopsy and finding that there is actually more change going on. Most low-grade paps are going to recover themselves and go away over time. A handful will kind of linger back and forth and come and go maybe every few years. And a small percentage over years and years and years, if unmonitored and untreated, could progress on to a higher lesion or cervical cancer.